Hey everybody, and welcome back. In this lesson, we're going to dive into the topic of assessments and the type of assessments that holistic life coaches do and what you're supposed to be doing with the information that you get from the assessment. If you think about it, all of our client information is contained in the words and expressions and stories that they share with us. So we're not talking about the specifics of maybe looking into someone's measurements or assessing what their body fat is, or even assessing human movement and how flexible or mobile our client is. We're not really even getting into any spirituality assessments. However, we are getting into the mindset of our client and assessing how they feel about many things related to holism and maybe how they feel about making changes. With holistic coaching, the results that you get are really dependent upon the assessments that you do with your client. We want to keep the following things in mind when we do assessments with our client. The first being that whenever we ask our client to complete an assessment, it's really important to be able to explain all of the rationale for your assessment. We want to talk about the outcomes or any measurements that we're going to be doing. The assessment, when done right, is a coaching tool that's used to stimulate reflection for the coach to ask better follow-up questions, but for our client, it begins to plant the seeds of self-awareness. Holistic coaches with experience will know how to pull positive information from our client so that we can appreciate their strengths and use that to identify through observation when our client is in a positive or negative emotional state with the attractors that we've discussed in mind. So you might be asking, what is an holistic assessment? This would be considered an overall picture of our client's present state of being, including their physical health, any lifestyle habits they present with, their strengths, their life satisfaction, and their readiness to make changes. So a snapshot to better understand and appreciate the client's life in a different context, one outside of our client's perspective. The coaching questions and approach for the client who has significant health issues such as obesity, hypertension, back injuries, or even cancer is different than the approach for a highly motivated, well-conditioned, fit client. If a client has suffered a major loss or was recently diagnosed with a major illness, understanding this situation early is important because of the impact on the client's interests and the ability to tackle change. An early indication of the client's strengths and healthy habits, as well as health risks and areas of challenge, make up your assessment. Now, assessments are particularly helpful at the beginning of a coaching program because they not only inform coaches, they also help clients to gain that self-awareness that we need to have as a foundation for them to build upon to make changes. No doubt that you have to do a complete assessment with your client, but we also need to be efficient with this time because each moment of every session has to be made as valuable as possible. And we don't need it to gather a whole lot of scientific data or to share or regurgitate scientific facts. This can feel more like an interrogation. Your assessment should really come off as more of a discussion. Assessments have become invaluable to coaches in the health, fitness, and wellness fields because they provide the process of answering questions about our clients' priorities, needs, values, readiness to change, and challenges with health and well-being, and this promotes self-discovery and expands the client's awareness. Now, by stimulating this type of mindfulness, assessments are the true starting point in the coaching process, even before the first coaching session begins. Clients will become generally more aware of who they are and where they're starting out with their current status. Clients also become informed for what well-being encompasses and what it means, and where they want to direct their efforts. Now, the International Coach Federation identifies creating awareness as a core coaching competency exactly because awareness precedes action in the fulfillment of our clients' goals. In fact, client progress has shown to depend greatly on expanding our clients' awareness of what's possible for them. And this can't be done for the client. Each client has to shape their own uniquely. Awareness is a little bit like our ideal vision, and that's if it comes from the client, our client pretty much has to take ownership of it. But what's really clever about this core competency is that it also minimizes any risk of provoking our client and provoking ambivalence or resistance from them. The client has to do this work for themselves, and assessments are an excellent way to get the conversation started about client responsibilities and how the coach works to support the client. Through listening, inquiry, and reflection, coaches can then expand their client's awareness even further in the process of helping the client to become more whole, centered, and holistic. When viewed as a positive emotional attractor, awareness can be seen as something that generates an upward trend of continuous growth and learning and development for our client. In this course, we've presented a few different sample assessments for you to use with clients. And again, these are considered coaching tools that are appropriate for use by credentialed professionals such as yourself in the field of health, fitness, and wellness. Ideally, a paper or an online assessment would be completed prior to your first coaching session with a new client, serving to enhance the client's self-awareness and to provide some foundational information about the client to the coach. An holistic well-being assessment would cover the many different components of well-being and health, including energy levels and the energy levels throughout the day for our client, life satisfaction, such as our client's sense of purpose. We also look at our client's mental and emotional fitness, such as how they cope with stress, or things like sleep patterns and stress levels in general. And then we can turn to some of the more physical assessments, including weight management, whereby we can determine our client's body mass index and other metrics that we can measure and compare later for change. Physical activity and nutrition usually go hand in hand for clients who are interested in health, fitness, and wellness. Normal health metrics such as blood pressure, cholesterol, heart rate, and one's relationship with their physician are all aspects of a formal medical evaluation and are usually done in addition to what an holistic coach would do. There are other benefits to having clients filling out a well-being or health and wellness assessment. The first one being building trust and rapport. Now, when we're building trust with a new client, an online or paper assessment provides them with a safe space in which they can first tell their story. This is also something that honors our client's personality preferences. So, for example, a client with a preference for being introverted will tend to be maybe more comfortable communicating such deeply personal information in writing, at least initially, than those with a more extroverted preference. The written word of the assessment is also really important because there's power in providing a client with an opportunity to see through writing a qualitative and quantitative summary of their current state of well-being. For the same reasons that writing down goals is important, seeing the information collectively can be both affirming and a powerful motivator for action within our client. Now again, prior to the first coaching session, take some time to carefully review your client's completed assessment if they are submitting one to you before you meet with them. While reviewing these documents, the goal is not to evaluate them, but to consider the responses with genuine coach curiosity, keeping in mind that the assessment never provides the client's entire story. We know that. Open-minded curiosity will enable the coach to ask better questions of the client during this assessment review and to challenge our own assumptions about our client and to develop a strength-based framework through which we can appreciate our client. This will allow us to be open to new information and energy shifts during that first coaching session. It's tempting to begin a client assessment review with a search for all of the problems or those areas to fix. Drawing on the lessons from the disciplines of appreciative inquiry and positive psychology, we know that what we focus on with our client will prosper and grow, and that our first questions to the client are really going to need to be carefully placed as we're being evaluated by our client right out of the gate. Sometimes we begin our initial review of the client's information with a focus on what's wrong, and when this is true, we're really more likely to support that tendency in future coaching sessions and not look at what's right. Additionally, it's much more respectful and empowering to frame our clients as creative, resourceful, and whole, especially as holistic coaches. Starting with the assumption that all clients can tap into their capacities and leverage their strengths for positive change will enable you to better support your client in the building of both self-efficacy and self-esteem. And as coaches, we learn how to appreciate our client from these parts of the assessment and the information that we review with them. The next task in reviewing a client's assessment is to look for the areas in which the client is presenting or feeling an emotional charge, either positive or negative. So the coach wants to look for places in which the client indicates that there's a concentrated energy one way or the other, such as in their priorities for change and the importance they assign to each of the wellness areas or holistic areas that you talk about. As you review your client's assessment, be mindful of your own energy and your own emotional reactions and responses. To wrap up your assessment review, take a moment with your client to brainstorm the positive and supportive thoughts about your client's ability to make desired changes and incorporate these into the goals that you make with your client. As holistic coaches, we want to consider our client's level of readiness for making changes. If the assessment includes indicators of your client's stages of change, consider how this might impact the coaching program and the client's needs. Remember the priority of cognitive and emotional goals in those earlier stages of change, and then the priority of planning and action goals in the later stages of change. Now, due to some design or user errors, or maybe even incomplete answers on an assessment, your client's assessment will sometimes leave the coach with more questions about inconsistencies in their responses. For example, a client may name improving nutrition as the highest priority, while indicating a low score in terms of readiness to change anything about their food intake. In these cases, the coach will want to take note and then be prepared to ask or inquire about the discrepancy in information during the first coaching session with this client. Your assessment review should indicate an examination or at least some exploration of any mental health or any medical concerns that have been indicated by the client. In other words, it's one thing to see something indicated on the questionnaire, but we might need to dig in further to know more about it. The health section of any assessment addresses areas and conditions that may or may not warrant medical clearance. This section includes a lot of different material for coaches, such as information on times when there's a need for a referral to another health professional for client concerns that you may not be trained to address, such as an eating disorder or psychology-related matters. An exercise program recommendation with specific limitations on exercise selections might be required for some of your clients. If there is a known disease, a medical clearance is required if any type of physical programming or physical activity will take place. This would include yoga and Pilates. For example, if a physician requires us to observe limitations in a client's range of motion, they are documented in your physician's clearance form and in the client file of record. If your coaching strategies require that you increase physical activity, coaches are best advised to follow the guidelines put forth by the ACSM or the American College of Sports Medicine. The initial type of exercise programming recommended can include strength training, aerobic conditioning, or any sort of mode that will best suit your client and their needs, but might require following guidelines from the ACSM, and these guidelines are included in your course appendix materials. We want all holistic coaches who are working both with a client or on themselves to try their own assessments first naturally before working with the client. However, if you already work as a coach or already have a subspecialty or skill, your assessment skills might be a little bit different and would be considered on top of these baseline skills that we do with our client. Let's say that you're a Feldenkrais practitioner. You would do a separate battery of assessments on top of the mind, body, spirit, holistic assessments that are described in this program. Naturally, you'd need to know more about your client to work with them if you're going to plan on using any Feldenkrais techniques with your client. So any additional skills, modes, or modalities you intend to use with the client might require that you do even more assessments. So coaches will really only do any specialty assessments in addition to those baseline assessments, and this is really by design in this course. We use those baseline assessments to talk to our client and to learn to appreciate their positive strengths and build trust and rapport with them. The benefits to the coach and the client are generally synergistic. There are times when coaches feel more curiosity or intuition about something that's been brought up or revealed within the assessment. These typically end up being the same concerns that clients want to address, and while maybe not a priority, the client being able to see that you have common ground is important to building trust.